Hello, everyone. It's Tuesday, May the 12th. This is our briefing. We've got a good bit of information to go over. I'm going to go through it as quickly as I possibly can. I don't want to hurry in any way with this. We've now lost 3 more people in West Virginia, our 55th, 56th, and 57th death. We lost a 70-year-old female in Jackson County, an 89-year-old male in Kanawha County, and a 56-year-old female in Nicholas County. Every day I say the same thing, but I don't want to get numb to the fact that every one of these people were probably moms and dads of somebody. And every one of these people surely has a name, and every one of these people are great West Virginians that we've lost. We've lost 57 people now, and I say it over and over and over. It's 57 too many. And but this killer disease is with us, and it's nasty. And it still continues to prey on our elderly. And so I ask you to please follow all the stuff that we've already told you, and please especially look after our elderly, and absolutely keep these people in your thoughts and prayers, because they and all their loved ones need you, and they need to feel like they're not alone, and they need to feel like their contributions to West Virginia and even their contribution in their death was not in vain. It was recognized, and their lives surely appreciated. We also lost a gentleman that was our director of the West Virginia Division of Forestry. His name's Barry Cook, and Barry had a terrible accident. And we lost him. He gave so much, and gave so much incredible expertise to many, way beyond just forestry. A really good man, and I had the opportunity to get to know him and know of the great work that he had done. And daggone, I mean, this stuff is just sad. That's all there is to it. His situation, a man with so much life in front of him and his family and all their loved ones. I just hate it, because any life that we lose is a life gone too quickly. But boy, I tell you, we've lost a good guy in Barry, and we lost it with a tragic accident. So again, Kathy and I are just pleading with everybody to keep that family in your thoughts, your prayers, and Barry as well. And I'm sure he's with the good Lord, and I'm sure he's doing great stuff there. And I just know that in my heart. But we lost a really good man there. I'm not going to go through and all this stuff, with the week 3, the comeback that we're in, and all the safer at home order and all that, and I'm not really going to go through all the stuff that we're bringing back in week 4. There are things though that I would like to touch on with you, and that's this. Our big box retail is coming back on May the 21st, Thursday before the Memorial Day weekend. And with that, we're also working diligently with our indoor malls to see, if we can get some really good guidance from them as to how they're going to protect the people, as they enter the malls and they go into a smaller, funnel type of an area. And as soon as we can get some real good feelings that our health experts and everything, are on board and everything, I'd like us to be able to bring back our indoor malls as soon as we possibly can. But I want, again, to underscore everything with just saying this. If you'll watch the national news, if we have got to go back. We have got to go back to work. We know that. But at the same time, what I'm trying to do is balance this to where we go back and we're protecting you in every way we possibly can. Sure, we've got everybody saying, if you're opening up tanning beds, why can't I be open as a spa? And our health experts are saying, because we have so much more hands-on potential problems there. There are so many different variations that we're trying to balance as best we possibly can. The bottom line of this whole thing is just this, and you've got to be sure that you understand this. This thing hasn't gone anywhere, and this thing can absolutely just snap back. And remember what I've told you over and over and over. West Virginia, the most vulnerable of all states, the most elderly, the most chronic diseases, the most vulnerable of all states, has pitched a perfect game so far. But yet, when this thing snaps back, if it does, it can really, really hurt us. We got to really be careful. And that's what we're trying to do with all in us. Now, I underline and tell you just over and over and over, follow all the guidelines. Absolutely. Wash your hands, keep social distancing, do everything you can possibly do to help the elderly. Do all the stuff. In some way, we'll get through all this. Now, yesterday, I said we're going to target June the 8th to be able to bring back our summertime youth sports, primarily non-contact, primarily, Little League baseball or softball or whatever it may be. Now, I want everyone to know just this. There's some variation to this disease that's going on that people can't put their hands on right yet that affects kids. And there's, I think, 93 kids in New York that are having a real bad deal with this, what's happened here. And I think we've lost 3 of them, or I'm not sure exactly how many we've lost, but nevertheless, we're monitoring that. And our health experts are on top of that, and they're absolutely on it, and they're watching it like crazy. You can rest assured one thing positively for certain. We have plenty of time between now and June the 8th. I'm trying to give everybody a heads up that if things keep trending the right way on June the 8th, I'd love to be sitting at a Little League baseball game and watch those little rascals out there playing. But if, in fact, we get more and more information that this thing is taking a twist and a turn to it that could affect our children, the last of the last people that we're going to expose in any way is our children. So just use that as a tentative possible date. But if this thing twists and turns in any way, we're not going to do anything that could expose our kids. Now, I just spent the morning with the National Guard at the National Guard warehouse at Rock Branch near Poca. And I went down there because to just see all the good work that they were doing primarily with the food bank. Now, they're doing a lot of the stuff down there that I don't really need to get into right now, but they're revolutionizing ways that they can make gowns or make masks and they showed me, their mobile testing unit that they have there that they can get right to a strike force about and everything. But the primary purpose was, down there to visit what the Mountaineer Food Bank and the Facing Hunger Food Bank in West Virginia are doing. And it is truly amazing. And I wish that everybody could see it and see this great work that's going on, because these people are knocking it out of the park. And and I just want to read just a couple of things. the National Guard joined forces with West Virginia VOAD, Mountaineer Food Bank, Facing Hunger Food Bank, and the West Virginia Division of Homeland Security and Emergency Management. The distribution center provides a full range of food supplies to local agencies, including dry goods and refrigerated and frozen goods. Once fully operational, the Rock Branch Center will support about 8 new jobs, and it will, in addition, it will add a million pounds of food stocks to the greater Kanawha Valley each year. It's amazing. The West Virginia DMAPS, which manages the warehouse, is supplying forklifts and pallet jacks and helping design and create, working spaces and at the new center. It is really a fabulous facility, and primarily the Guard and General Hoyer under his leadership is doing great stuff. I mean, if you could just stand there, with these young people, and you could see their commitment, and you could see their professionalism, and you could see how they look at and attack a mission, it's easy to see. It's easy to see how in command we've been through this whole process. The Guard has been instrumental beyond belief. Our medical experts, instrumental beyond belief. DHHR, all that they're doing. Dr. Schlemp, it's just so many different people have stepped up. And what you see in West Virginia is the very thing that a lot of people thought, oh, West Virginia doesn't have that. But what you got and what you see is you see smart people. You see people that are craftsmen. You see people that are absolutely knocking it out of the park and organized. And you just see good stuff happening from them. So it was really a pleasure to be down there today, and I commend them in every way. Now I want to talk just a second about Workforce West Virginia. Last night they served 16,000 people that were paid last night. And $18 million to independent contractors went out the doors last night. Plus, get this, an additional $51 million went out the doors to individuals on their $600 a week pay. And so they also took in 28,000 phone calls since May the 1st. These people they're doing a good job, and they're working really hard to get it all done for all of us. I remind everybody, I've got 2 or 3 more things here real quick. I remind everybody again about the census. Please call your neighbors and call everybody and make sure that we're all counted. And I've just got 2 or 3 more things here real quick. From the standpoint of, this is just human nature. But all of a sudden, everybody knows, because I told them, everybody knows there's a big chunk of money that's coming into the state of West Virginia. Now, we're all awaiting the guidelines as to see exactly how it can be spent and in the most prudent ways that it can be spent. And our people are working around the clock, nonstop, coming up with every different scenario that you can possibly come up with. Now, in that, you always have to have people that are offering up opinions, which you love to have, but offering up, just maybe opinions that are driven from some political bias or whatever. We came out and we said to our counties and our cities, we said just this, and this is what we got to do. We said, we need you to submit detailed records of what your needs are going to be. And we're working with them. And we want to be able to do that. The other day, just out of clear blue nowhere, somebody said, I don't know if it came from wherever it came from, but it said, someone said, I think we ought to send $600 million to the counties. And then Senator Manchin said, I think we ought to send $600 million to the counties and everything. Well, I know Joe really, really well, and I know Joe doesn't want us to be just coming up and saying, well, we're just going to lump sum a bunch of money. Joe knows, and I absolutely know that he wants it to be this way. He wants every single T to be crossed and every I dotted. We absolutely, right now, we are trying in every way to get information from you that are direct dollars that are directly related to the COVID. And if you have that, we want to send that money out tomorrow. That's all there is to it. We want to send out that money tomorrow. But here's our hope. Here's my hope. My hope wholeheartedly is just one thing, and it's just this. And it is that the guidelines that we're waiting on from the House are going to be relaxed to where we're going to be able to send the counties and the cities and the state significant more backfilling dollars, and we're going to really be able to really help. And that's my hope. Now, if you have a direct COVID expense today, we want to send you the money, and we're doing that. We're absolutely trying to do exactly just that. But I will promise you just this. There's not going to be a dollar go anywhere unless it is absolutely not truly transparent and exactly done the proper way. And that's the only way I'm going to be able to, I'm going to do it. Now, as I've said, and I'd just like to just touch on just this, we want any COVID expense to go out tomorrow. We are absolutely waiting on the additional guidelines that's coming. We want to be totally transparent. And we want to be really smart and use these dollars to the very best of our abilities in the state of West Virginia, that we don't stub our toe and end up just holding the bag. We need, as business people, and that's what you've got me here to do. As a business guy, we want to make the right decisions that will set West Virginia on a good glide path for a long time to come. And the last thing I would tell you is just this. There's not a chance on this planet that I'm going to do anything here for political reasons. I hate like crazy when we start trying to jockey around with all this stuff, and it's nothing but a political stunt. That's all in the world it is. We got to stop doing this kind of stuff. This is too important. We've got people dying. We've got absolutely a state that is hemorrhaging, and counties and cities that are hemorrhaging, and people that are still unpaid that are hemorrhaging at home. We got to be smart. And the last thing on earth that I want, the thing that just makes me sick, is when we absolutely try to politicize things that we don't have any business doing it that way. Now, I've got still just a couple other things. One, I've talked about the indoor malls. I've talked about the census. I just want to double check everything here real quick. But I want to just end with just this real fast here. Again, you don't have these charts, but this is my chart here and everything. Yesterday and today, we had the lowest number of positives in the state of West Virginia that we have had since we began tracking this on March the 23rd. On March the 23rd, we had our first positive, and this is real fine print and everything, so forgive me, if I can't quite see it, and it's perfectly possible. Okay, on March the 23rd, we had our first positive. On the 24th and the 25th, we had 4 each day. On May the 11th, we had 6. And on May the 12th, we had 5. We have had the lowest numbers that we have in the last 2 days that we have had the first 3 days of when our first positive came in. Now that's good stuff, really good stuff. Our cumulative average now is down to 2.11. Our amount of testing is off the chart compared to all of our neighbors or the nation. We're at 3.6. Virginia's at 1.7. Pennsylvania 2.2. Ohio 1.7. Maryland 2.7. And Kentucky 1.9. And we're at 3.66. Now, we have had the second consecutive day that we have dipped significantly below 1%. In fact, we're below 0.5%. We're 0.4% for 2 days in a row. You know, as far as our active cases and recovered, it's still continuing to widen, and it's all working and working well. I'd end by just telling you just this. If you looked at these numbers, everything tells us we can move more and more towards giving you more freedoms back and more of a normalcy. But I would only ask and plead with you to know that this thing can whiplash back on us, and if it does in West Virginia, it'll be bad. Every single day, West Virginians, you are killing it. You are absolutely just knocking it out of the park over and over and over. The numbers are unbelievable. That's all there is to it. Just please, please, stay the course. Stay the mission. Follow what the great National Guard was doing right down there. Stay the mission. You're doing really, really good stuff. And my last is it's Amanda Barron's birthday today. So anybody that can drive her crazy about that, please do so. She does a lot of great work. She works really hard for our state all the time. We're proud of her, and we wish her a happy birthday. That's all I've got.
All right, thank you, Governor. Now let's go to Major General Hoyer with the West Virginia National Guard.
Good afternoon. I'll highlight a couple of things today. As the governor mentioned, he had the opportunity this morning to tour the consolidated facility at Rock Branch that showed VOAD, the food banks, Department of Agriculture, the Department of Homeland Security Emergency Management, DHHR, Corrections and Prison Industries, also all working together under one operation and continuing to function in an interagency, intergovernmental approach going forward. Today, we continue to support Department of Health and Human Resources and our counties with testing support, particularly in Hardy County today. Additional testing sites will be coming on over the weekend and over the next several days as part of what Dr. Marsh has described as our effort to biopsy different portions of the state to see the health of our state related to the virus. And the last thing I'd leave you with is, as I mentioned yesterday, and Jordan, if you could put up on the screen, we have flyovers occurring tomorrow from both of our air wings in honor of our medical professionals on the front line. In the next several days, there'll be some additional flyovers at some other locations. I just want to assure folks that there is no state money being spent on this effort. This is part of our training regime and being able to coordinate training in with flyovers to ensure that we use the appropriate DOD dollars to maintain the readiness of our air crews going forward, and at the same time honor those folks on the front lines and give them thanks for the great work they're doing. Thank you.
Thank you, General. Now to Secretary Bill Crouch with the West Virginia DHHR.
Good afternoon, everyone. Just want to mention one issue related to our foster children. We received word in the last few days that there is a suspected imposter who is calling and trying to obtain Social Security numbers of foster children under our care. The imposter claimed to represent Aetna Better Health of West Virginia and its Mountain Health Promise program, and which contracts with DHHR to assist foster families throughout the state. Neither DHHR nor Aetna will ever contact you by phone and ask for a child's Social Security number via an unsolicited phone call. So please be wary of that. The Attorney General's office was contacted about this, so just want to make sure that our foster families know that, and please be careful. We appreciate our foster families. Again, we want to protect our foster children and certainly give our foster families all the help we can for them to take care of our children, and we appreciate them very much. So that's actually all I have today.
All right, thank you, Secretary. Dr. Clay Marsh, our coronavirus czar, is also joining us today and is available for questions. Once again, we're holding today's briefing with media members joining us virtually to practice good social distancing. The first questioner we have today is Amanda Barron with WSAZ.
Oh, sorry, thank you very much, and thank you for the birthday wishes. They're very much appreciated. I wanted to ask a question about small businesses. We see large crowds at some of the bigger stores that have been allowed to remain open. And there is a trust that's there to allow for people to do what they need to do, and that self-policing. But what do you say to the restaurant owners or who maybe feel like they can't operate at 50% and it's simply not cost effective for them to do that, and they feel like they're losing their livelihood during this time? What can you say to them, and what can be done to help them? Thank you.
Okay, Amanda, I'll have to answer that. This is a constant topic, when we're having our briefings with the president and the vice president. It is surely problematic, and I get it. I get it wholeheartedly. If you just look at it from both sides of the equation, we as a nation want to be able to bring our restaurants back, but absolutely we as a nation know that if you bring a restaurant back at 50% occupancy, there's a really good chance that it can't make it. Now, with all of that, there's a lot of discussion that's going around, that centers around restaurants. And so all I can say is just this, is if in fact, your restaurant it's not economical to be able to bring it back at the guidelines that we have now, that's the only guidelines that I can give you, is the guidelines that we have right now. To give you guidelines beyond 50% would be foolish, and so we can't do that today. The other thing I would tell you is just this, is I am pushing on the governor's call, and I am pushing as diligently as I possibly can for all kinds of different things, but that is surely one of them. And all kinds is just this, is just think about just this. We have many businesses that got the Small Business Administration loans, the PPP loans, in the beginning. And then they had 8 weeks to be able to pay 75% of those dollars back to employees or to health benefits or whatever. And if they don't, then they have to repay 100% of those dollars. A lot of that 8-week period hasn't even started yet. And yet their time clock started when they got their money. Well, that's not very fair. And the other flip side of it is, in my opinion, from a small business standpoint, what we really need to be able to do is, these small businesses, a lot of small businesses have rent and utilities and whatever it may be like that and everything. And by the time they pay that, to pay the 75%, the formula just doesn't work. And so a formula that would be more like a 65-35 may be a whole lot more fair than just what they have. But I understand just this. Our federal government had to come up with a plan in hours. And to be able to come up with the plans that they came up with in hours is dadgum good. That's all there is to it. Everybody's trying to fit a 10-piece puzzle into a 1-piece jar. And so in all of that, I would just say, from the standpoint of the restaurant owners and so on like that, I hope that there will be some additional assistance that will come, or clarity that will come, that will be able to benefit them, because I know the quandrum that they're in. And so, but it's true in many different areas, and we're working on it as best we possibly can.
All right, thank you, Amanda. Next, we'll go to David Beard with the Dominion Post.
Hi, this is David. I have a two-part question dealing with hotspot counties, and I guess partly tied to the restaurants again. First part is, we have the gathering limit of 5 people, so how does that apply to restaurants that want to reopen? Are they limited to 5 people inside the restaurant? I would think 5 people per table sounds kind of cramped and dangerous. And part 2 is, and you've said you're reformulating the hotspot criteria. Do you have any sense of when you might be reconsidering counties that could either come off or might actually be added on to the list? Thanks.
Okay, David, I'm gonna bring up my general counsel and let him answer that, because I think he can do it better than I. And to be perfectly honest, I didn't hear the last part of the question. So.
Okay, David, the 5-person gathering, even in the hotspots, that refers to public gatherings. So that would be some outdoor gathering, like a picnic or an event or some public speaking engagement. It wouldn't apply to the businesses the same way. Obviously, we don't have 5 people limited in a Walmart. It's based on square footage. So the specific guidelines that are put out for specific businesses are what is to be followed. That number of 5 people in a public place is not for the businesses.
David, what was the second part of your question again, please?
You're reformulating the hotspot criteria, and I'm wondering when counties might know if they could be taken off or added back onto the list under the criteria you're working on.
Still working on that.
Yeah, I could say just a couple of comments, then I'd like to pass on to Dr. Marsh and everything. But my comment would be just this: we're in constant contact with everybody, from our experts to the health officials, to all the county officials, to everyone, And so, Dr. Marsh or Dr. Schlemp, maybe you can answer that better than I.
This is Bill Crouch, Governor. We have put together a new approach, a new way to designate those counties. We're trying to get that in front of everyone so we can make sure everyone's on board with that and everyone agrees. That should be rolled out here in the next 2 or 3 days. So we're happy to get that and talk about that as soon as it's ready.
Okay, thank you, sir.
All right, thank you, David. Next, we'll go to Annie Moore with WVVA.
Hi, Governor. There's been a lot of changes made over the past couple months across the state. Are there any changes that you foresee being permanent after all this is over, changes to our culture and way of life?
Well, I do, Annie. I guess this is more than anything, but you turn on the television and they're having reruns of a golf event or a baseball game or whatever. And really and truly, you see people almost sitting on top of each other. And it was really, we didn't think anything about that 2 months ago, 3 months ago. And now when we see that, it makes us almost jump back like, whoa, gosh, we couldn't possibly do something like that. And so I think as we go forward, I hope and pray that we'll end up with a drug that will enable us to do that and have gatherings and sporting events and whatever it may be, just like we used to have. But I really believe that people will remember, this pandemic will leave a scar with all of us. And it will be with us, I think, throughout all of our lifetimes. All of us will remember just how difficult this has been, and surely the people we've lost and everything. And as we go forward through our life, you know, my mom grew up in really tough times. You know, my grandparents, my mom's mom and dad, they didn't have indoor plumbing. You know, one time there was 10 kids in the family and 3 of them at war at the same time. You know, Mom absolutely throughout all of her life, you know, if she were to cook with aluminum foil, she would wash it. And then she would fold it up and put it in a drawer and everything, because she remembered just how tough times were, you know, in her life. And I think we'll remember, and we may not shake hands as much or embrace as much, or we may wash our hands more, but I hope and pray that we'll have the drugs to be able to move forward with normalcy, but at the same time, it'll change us to some degree.
All right, thank you, Annie. Next, we'll go to Paul Mullen with WCBC.
Good afternoon, Governor. Good afternoon, everyone. My question has to deal with mental health and how much you're talking about that in your group meetings and what parts give you concern as we move forward.
Well, I think Secretary Crouch, you know, we're talking about this all the time, and Secretary Crouch and, you know, Dr. Schlemp can answer this better than I.
Yes, thank you for the question, Paul. We truly do talk about that a lot. As you know, this is mental health month for children, and we are constantly looking at how we can do a better job in communicating throughout the state with individuals who need more care and need assistance. This is, as the governor said, a difficult time, and it is changing our lives. And we have individuals who have difficulty going through this kind of stressful time. And we want to make sure that we provide services. We have toll-free numbers, as you probably know, that we put up often. We're trying to communicate with our providers, behavioral health centers throughout the state. We want to be there and want to be available for folks, whether it's individuals who are struggling, paying rent and trying to buy food, or whether it's foster families who are struggling and having difficulty, families who, for the first time in a long time, are living together in close quarters and not just living together from 5 or 6 o'clock in the evening until the next morning when they can take the children to school, but they're together for long periods of time, and that can be very stressful. On the other hand, it can be an opportunity to bond better and teach your children more. So, but it is difficult. That's a great question, and we are trying to do all we can in that regard. But it's a concern as we watch how this pandemic progresses. So, thank you for the question.
Thank you, Bill.
All right, thank you, Paul. Next, we'll go to Kenny Bass with WCHS.
Hi, this is Kenny Bass with Channel 8 and Fox 11 in Charleston. Happy birthday, Amanda. I have a question for the governor or for Dr. Marsh. The state has had very little compunction about issuing orders related to the COVID-19 pandemic about who can work, who can be open, who can be closed, et cetera, gatherings, and on and on and on. And the governor has been very forcefully recommending that face masks be worn in public, but he has stopped short, to my knowledge, of mandating that face masks be worn in public. I'm wondering, since Dr. Marsh tells us that if we can reach that 60% number, that it would be effective in stopping the spread of the virus, what is the compunction against mandating that face masks be worn in public? Is there some type of constitutional or legal issue, or are there questions about the authority that the emergency order has given the administration?
Kenny, let me make a stab at it in the beginning. You know, there are some people that, Kenny, when you try to force people to do certain things, and maybe people are strongly, adamantly against doing a certain thing, you know, you lose people and divide. I have from day one, I've said it over and over and over. We got to stay together as West Virginians. Now, I urge, but I am not going to make it mandatory at this point in time with numbers doing what they're doing and everything. But I urge everyone, I urge like crazy, if you go out, that you wear a face mask. But at the same time, I want us all to remain together. We'll never be able to push the rope, but we'll be able to pull the rope. And if we all work together and we're just trying, we're trying really hard. You and I both know that there's a percentage of people that, the first thing that would come out of their mouths is, well, by dog, I'm not going to do that. Well, if we start I'm not going to do, that just leads us to be divided. And that's why we've done so good. That's why West Virginia, you have done so good, is because we've been together all the way. And in doing so, look what you've done. And that's not 100%. I know it's not 100%, but it's that close and everything. And so I'm really proud of you. And that would be my thing. Clay, I'll defer to you now.
No, thank you, Governor, and thank you, Kenny, for the question. From the very beginning of this pandemic, we really focused, as the governor said, on counting on the cooperation and the commitment and the community that West Virginia does so very well and that our citizens do, that you do. And we know from a lot of mathematical simulations that if we didn't do anything, then we would have had a surge and it would have overrun our health enterprise and our medical care. We also know that if we would have forced people, at least as far as these simulations go, to stay inside and to socially distance and to enforce that by some sort of top-down kind of law or ordinance, then it wouldn't have worked as well either. And what we found is that working together, and we said at 75% or 90% of us doing that, we could make that surge a river at 75% or just a stream at 90%. And we know today it's the same issue with face masks or face coverings. We know if 60% of people wear face masks or face coverings that are 60% effective so that you can't see through them, can't see people's facial features, then we can keep that R0 down to about 1. And the more people that wear those masks or face coverings, the more our R0 will stay down. So I think the governor's wise. We don't want to separate. We want to bring together. But remember, in this pandemic, you're not just taking care of yourself, because the compounding, the spreading, the rapid transmission of this virus between people is what creates a surge and then creates a much higher death rate. And as the governor said, we have such a vulnerable population. But by doing what we should be doing voluntarily and together, we will do really well. So we do advocate face masks, but as the governor said, requiring them would defeat what we're trying to do by staying together. So thank you.
All right, thank you, Kenny. Next, we'll go to Brad McElhenney with West Virginia Metro News.
Hi, Governor. Hi, everybody. Good to see you. Governor, I know you get a million questions from people about when is this going to open and when is that going to open. We get those too, please, from people saying, would you ask the governor? So I've got a few and just hope to ask you about them. One is gyms. People may want to begin to work out on the treadmill or the elliptical trainer or lift some weights. So gyms, casinos, which was on the list of things where there was no particular timetable yet when the comeback was announced. And then daycares in the sense of how they open. For example, I think there's a federal recommendation about when children return to child care centers, try to keep groups of them from intermingling. So is there any further guidance on, as daycares open, what the guidelines are to make it safe for staff, children, and parents? Thank you, Governor.
Okay, Brad, let me just say this. First of all, we started out and we had a lot of essential businesses that we allowed to still be open. And now we're getting down to the end here to where we're getting fewer and fewer and fewer things that are still not open. And trust me, as we get to fewer and fewer things, you know, people are voicing opinions even louder, saying, well, why not me? You know, from the standpoint of the gyms, I would say that will be very soon. From the standpoint of the casinos, here's what I know. Different states all across this country now are starting to open their casinos. And some of them are opening up on, that are opening up on May the 20th, and some of them opened up on May the 1st, and some of them are saying we're going to open up on June the 1st, and there's a lot of activity in regard to the casinos and everything. The one thing we don't want to do or didn't want to do is just this, is open up our casinos and run a bunch of people from right across the border into West Virginia and right on top of us, because the casinos would surely be a gigantic draw. You know, we know things like, you know, the Hatfield-McCoy Trail will be somewhat of a draw, but not a draw like the casinos. So I would look for the casinos to open within this state sometimes towards the very last days of this month or within the window of the first 15 days of June. And as far as the daycare and everything, you know, we're trying in every way. I know, you know, Secretary Crouch and them are working on it and everything to be able to test all the workers there. And I surely know from the standpoint that you can't keep kids from piling on top of one another and doing all the stuff that kids do. And we're trying, you know, again, that's a terrible balancing thing, because people got to go back to work. They've got their children that they need to have in daycare, and, you know, and keeping all those balls in the air is difficult. So we're trying to do the best we can possibly do with that as well.
All right, thanks, Brad. Next, we'll go to Taylor Stuck with the Herald-Dispatch.
Hi, this is Taylor with the Herald-Dispatch. Kind of piggybacking off of that question from Brad, I've also been in contact with some gyms who are, you know, a little confused about the guidelines. And so my question is, would a gym, you know, that offers physical therapy, if I'm a member of that gym, would I also be able to go and work out there under these guidelines, even if I'm not a physical therapy patient? Or is that not the intent of your original guideline?
Well, to be perfectly honest, you know, when we put out the original guideline was just this, and that was the gyms were closed unless it was under the supervision of medical personnel, because people were there, you know, primarily it was the thought process that we had was people that need the gym for rehab, we're okay with that. Now, to be perfectly honest, we got pushing the envelope there further than I probably intended it for it to be pushed. But I'm very hopeful that we're going to remedy the situation with the gyms and be able to get back into gyms as soon as we possibly can.
All right, thanks, Taylor. Next, we'll go to Charles Young with the WV News.
Hi, this is Charles Young with WV News. My question's for Dr. Marsh. Dr. Marsh, could you elaborate on what the governor mentioned about this new effect on children that they're seeing in the New York area? Have we seen that in West Virginia, and what are we looking for going forward on?
Governor, you okay with me taking that?
No, please, Clay. No, please, go ahead.
So thanks for the question. So thank you. There are new findings that are coming out with the COVID-19 virus here in the United States. And the specific disease the governor mentioned is a disease that is inflammation of the great blood vessels called Kawasaki's disease. And this is a pretty rare disease in children. And it appears as though that the COVID virus here in the US, at the very least, is really focusing largely on blood vessels and blood vessel-based problems. So we see people with strokes, we see people who have heart attacks from this virus, we see people kind of inflammation and blood vessel obstruction in their feet that people are referring to as COVID toes or COVID fingers, where you see kind of a purplish discoloration of that. The Kawasaki's disease is very unusual and has to do with inflammation of the lining of the blood vessels like the aorta, which is the big blood vessel that carries oxygenated blood to the body. As far as I know, we haven't had a reported child with Kawasaki's that we've connected with COVID-19 here in West Virginia. But because of the number of cases that New York has, that we are seeing that complication and as Governor mentioned, a small number of children in the New York area. So it's telling us that, as we said before, that while certainly older people are affected by this virus more than younger people, and that's the reason why testing all of the nursing home residents and staff and these congregate, facilities and vulnerable people is so important. But it also says that young people are not really totally safe from this virus either. And although we certainly don't want to be alarmists for parents, because every parent worries a lot about the health of their children, it does say that being careful and making sure that we're not spreading this virus into people, children, or even adolescents and young adults is so important. And that's why I think that the guidance to test daycare workers and try to make sure that these environments are as safe as possible become even more important for us in West Virginia. So thank you.
All right, thank you, Charles. Next, we'll go to Steve Adams with Ogden Newspapers.
Yeah, Steve Adams with Ogden Newspapers here, coming to you from my car. I'm seeing where there's some groups that are wanting to try to get the state government to try to protect workers in regards to possibly losing the unemployment they're on should they be called back into work for businesses that are reopening. I wanted to get your take on that and see what thoughts you had. Thank you.
Okay, this will be a great ending for me. And Stephen, thanks for the question. And so Jordan, you won't have to go to me to wrap it up after this, but here's what I would say to everybody. I would say, let's please stop the politics. Please stop the politics. That's all there is to it. That's all this is. The same groups came out and said, we need to release all the prisoners, all the rapists, all the murderers into prison because of the COVID, and we don't have a positive case in our correctional facilities. And now the same groups are saying, let's do this. Let's let no one go back to work. If they don't want to go back to work, nobody go back to work, and we'll just extend our unemployment forever. Well, for crying out loud, I'm not the king. There are federal guidelines that we all have to follow. Absolutely. And this is nothing but politics in a situation to where we have a pandemic where people are dying and we have economic stress beyond belief. Now, on the other side, from the standpoint of the economics, I've said over and over and over, stop the politics. Stop the politics. We can't send $600 million over here and $600 million over here unless you want to just do it and be bankrupt tomorrow in every way. Just stop the politics. We're going to do the smart thing. We're going to do absolutely the most transparent things. We're going to do the business stuff. And absolutely, we are trying with all in us. We have got to stop the politics. This is too serious a situation. It is an absolute pandemic that nobody's ever dealt with, and there's a lot of people here that are doing a lot of really good work. We just got to stop the politics. Thank you.